What if the mere act of speaking, laughing, and swallowing was a battle? One of the brave survivors, a dear patient of mine, told me every breath was a struggle. Ladies and gentlemen, every year 54,000 people get diagnosed with head and neck cancer, and most of it is preventable. Nothing disfigures your body more than head and neck cancer, and especially throat cancer. In this video, we will go over the early signs of throat cancer and also head and neck cancer in general. What are the stagings of the cancer? What are the risk factors, treatment modalities, and in the end, we will discuss prevention. Head and neck cancer incorporates your head, neck. But the throat cancer, which is the topic of discussion, includes three parts of this broader head and neck, which includes your pharynx or the throat. Next is your voice box or the larynx and the tonsils. So when we talk about head and neck cancer, this includes everything, but the throat cancer involves your throat or the pharynx, your voice box, and the tonsils. The reason throat cancer is very tricky because usual minor ailments we all develop. Who does not develop sore throat, doesn't have a laryngitis, or have a tickle back of their throat? But these vague symptoms make it very tricky to diagnose them early. And also, internally, every part of head neck is connected. If you have symptom in one, you could have referred symptom somewhere else and complicates the issue. We should start with the risk factors. If you are a smoker, pay attention to the signs which I'll be describing, because you need to have risk factors to develop this cancer. Anatomically, we can divide our throat into three components. The upper throat, which is right behind your nose, is called upper throat. Something is blocking your air passages. Then the throat, which is behind your mouth, that's the middle throat. That's where you have difficulty in swallowing and sticky feeling. And then your throat, which is below your mouth but above your voice box, that's where you have difficulty in swallowing. These are the different combination of symptoms which you get. But anybody who has persistent sore throat, persistent change in voice, difficulty in swallowing, chronic cough, coughing out blood, or unilateral or one-sided ear pain, which is recurrent, keeps on coming, and weight loss. These are the early signs. You should have guards up if you develop any of these symptoms, plus you have one of the risk factors. Why people develop throat cancer? Smoking is the biggest risk factor. Chronic alcoholism, acid reflux, gastrointestinal reflux. Smoking, drinking, gastrointestinal reflux makes the risk factors very high. Two viruses, HPV virus, especially the strain 16, and Epstein virus, which gives us infectious mononucleosis when we are children. These two viruses are also connected with throat cancer. Malnutrition, weak immune system, especially in patients with HIV disease or immunosuppressive medications, they are at high risk to develop this throat cancer. Also, the throat cancer can affect your voice box, your eating, your swallowing, your laughing. And the treatment involves changing the structure of your basic anatomy, which makes us human, which makes us feel like human. So if you are really concerned about throat cancer, stop smoking, stop drinking, take care of acid reflux. And if you are immunocompromised, pay attention to these symptoms. Like we use in medicine TNM classification. T stands for tumor size, N is the lymph node, and M is for the metastatic, how far it has extended. If the cancer is located just on the inner lining of your throat, voice box or tonsil, that is called carcinoma in situ. This means it's just in the outer layer, it has not spread, it's not gone. That is the best stage to diagnose because treatment will yield 100% result. But just from the inner lining to 1 centimeter, that's stage 1. 1 to 2 centimeters, stage 2. 2 to 4, stage 3, and then anything above that is stage 4. It's draining to the first chain of lymph node, that's stage 1. If it goes to second, then it's distant. We stages 2 and 3 based on that. Metastatic is once it crossed the local boundary and it has become widespread. So there are 4 stages. Stage 0 is just located in the inner lining. Stage 1, 2, 3, and 4. Prognosis on all stages is very good. Treatment modalities include, if we catch them in early stages, the treatment is surgery, radiation, and sometimes chemotherapy. The problem with throat cancer is because it will involve this area. We have to put a PEG tube, you may need tracheostomy tube, and that adds a lot of pain and suffering to this cancer. Best thing for any kind of cancer is to live clean. Make sure if you smoke, stop smoking, stop drinking, get vaccinated against HPV. If you are immunocompromised, keep your guards up and look for the treatment quickly and do not ignore the symptoms. Not every symptom is cancer. You have to put the things in context. In a nutshell, this cancer is preventable and is treatable, but it comes at disfigurement and a lot of pain and suffering. You could avoid it. I have seen a lot of people, they go through successful treatment for head and neck cancer and then unfortunately they start smoking again because our habits, our vices take over. And when they start doing it, they have very high risk to develop lung cancer. So if you have a throat cancer, because the risk factors are pretty much the same for the lung cancer, make sure you are screened for lung cancer. These days, the United States Preventive Task Force has approved to screen you for lung cancer. Please stop smoking, and if you are a cancer survivor, do not start smoking. As a physician, I could tell you that it's very painful for you, but it's equally painful for us. When you cannot swallow, your mouth is raw due to radiation, and we have to work with you day in, day out. And then your vices take over and you start smoking again. Painful. I hope I have made a case to prevent it and keep your guards up for the early signs and get treated and do not smoke.